Hello, my name is Jerzy Krzywon. I am from Kraków, John Paul II Hospital, Department of Vascular Surgery and Endovascular Procedure. There are many different options to recognize artery stenosis and occlusion in lower extremities. We have to choose the technique that is most comfortable, that we are familiar with, and that is best for the patient with best patency and safety. Atherectomy is endovascular procedure performed to remove plaque from arteries by cutting, shaving, drilling and pulverization by sanding, resulting in enlargement of treatment lumen. One of these technique is directional atherectomy with Hawk-1 device. The quality of this technique was confirmed in some clinical trials with and without drug-coated balloon angioplasty. The Hawk catheter is indicated for use in conjunction with the Spider FX embolic protection device. You can find it in the lower part of screen. I would like to present a case of 79 years old man, non-smoker, 1 year after recanalization of occluded left SFA with stent because there was long occlusion. Patient with well-controlled hypertension and no other comorbidities. Claudication distance below 100 meters of the right leg. Stenosis of femoral popliteal segment was identified in angio-CT. You can find it here. Best picture, and here again this pathology. The first step was local anesthesia of the groin region, then puncture of common femoral artery. Needle was placed in the common femoral artery retrograde direction. We crossed the aortic bifurcation, and after angiography we confirmed pathology in the artery, lower part of SFA and epipart of popliteal artery. We placed long sheet in the common femoral artery and reached the stenosis with wire and cross it. We introduced filter system, and using attached wire we reached the lesion with the Hawk-1 device. Device was placed in correct position after angiography, and we performed procedure. There was no predilatation this time. First was necessary to confirm correct position. Then Hawk-1 device was turned on and passed through the stenosis. 2 or 3 slides in each position. After that, device was turned 2 clicks clockwise, and slides and movements were repeated. That's the procedure, atherectomy and control angio after a few slides. Again, procedure, device moving through the stenosis, walking, destroying plaque. Again, in another position. Filling the container was observed all the time on the screen, and necessity to empty it was assessed after every 2 slides. And control angio. When the container was full, it was necessary to remove plaque scraps. It was performed keeping filter stable distally to the stenosis in artery, of course. Removing scraps was performed under eye control, and next Hawk-1 device went back into the artery. Device was passed through the stenosis more than 15 times. After procedure, control angio. Again, few slides. And When entire circumference of the vessel was covered by slides, angiography was performed and correct result of atherectomy was confirmed, and we decided to complete therapy with drug-coated balloon angioplasty. And that's working balloon. Angiography showed good result of this procedure, treated part of vessel, and patient hasn't developed claudication 2 years after this endovascular operation. So the claudication didn't reoccur in 2 years after procedure. And final angio. And thank you for attention.